Now to COVID kids in the dentist. A newly released poll finds that 1 in 3 parents say it's been difficult to get preventive dental care for their children. Dr. Jen Aston joined us with more on what it could mean for your kids. Good morning, Doc. Always great to see you. And tell us what this nationwide poll found, Doc.
Well, Michael, this is another example of the ripple effects of COVID. And we think of dental health as separate than physical health, but it's really not. It's really a critical part. So interesting survey findings of parents during the pandemic. They found that 32% found it difficult to schedule an appointment for their child with their dentist. About a quarter found that they had to delay these routine dental visits. And 7%, Michael, could not get an appointment at all. So again, it's important to always think of the indirect consequences of this pandemic and the effect that it has particularly on children.
Absolutely. And it's been recommended for children to get regular cleanings and checkups about every 6 months. So what can parents do until they're able to get an appointment for their child?
Well, first of all, I think they're already doing it. One of the good findings of this survey is that they found that while it was hard to get into the dentist's office, that parents and kids were engaging in more positive, beneficial behaviors at home. So less sugary beverages, more brushing 2 to 3 times a day, and even flossing. So again, kind of a silver lining in there, but to be crystal clear, you really don't want to avoid or delay dental care. It is critically important.
You said flossing and Amy looked at me and started laughing. But anyway, Jen, what should people know about going to the dentist right now if you're a child or an adult?
Well, there's so much fear and concern because of the close proximity that the dentists and hygienists are working on their patients. But to be clear, the American Dental Association and the CDC has had COVID guidelines in place since last spring. They have always taken a lot of aggressive steps to protect safety with face shields and masks. And they're even changing the way that they do cleaning. And I hate to say it, but they're doing that hard scaling more, less of the ultrasound blast to protect everyone in the room. So I'm a white knuckle dental patient, but listen, it's got to be done. It's so important.
It's got to be done. That is right, Doc. And thank you. As always, we really appreciate it. And Amy, you love when they give me the dental stories.
Oh, okay. Yeah, you know, it's great. But, you know, the flossing.
Oh,
this is the flossing we do. No,
that's what okay.
No. I was also just kind of winking because I'm not a huge flosser and I need to do better. All right.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.